Oh, good evening. Good evening, everyone. Good evening. Welcome to this evening's conversation. Today, we're talking about heavy periods are not normal. But before we begin tonight's conversation, I'd like to share a scripture that resonates with me and speaks to healing and health, really. And it's 3 John 1 2. And says, Beloved, I wish above all things that you will prosper and be in health, even as your soul prospers. And honestly, that tells me that our soul prospering is really important for our health to do well as well. And so, things around our minds, our thoughts, the things we allow around us, as a man thinks in his heart, so is he. And so, it's really, really important the things we think about, the things we talk about, because that, either we like it or not, eventually affects how we begin to see things and also affect our well-being. So I just thought I should share that really resonates with me. And so I'm more intentional around about what I allow around me, what I speak, or what I allow people to say around me, because if I'm thinking right, if I'm speaking good and well about myself, that's my health will also follow suit, basically. Anyway, yes. Well, I hope tonight's conversation, will bring knowledge, empowerment, healing, support for women, and reassurance, honestly, that um no woman should have to suffer alone or suffer in silence. That is about speaking up and being finding a support network for yourself. you know. And whilst I'm waiting for the doctors, I haven't seen my guests tonight, but I'm gonna give them time to join. I thought I'll share, that scripture that resonates with me, on health and well-being. But tonight we're talking about heavy periods are not normal. They are not normal. They are not normal. I have my own fair share of the story of heavy periods, but once this conversation begins, we can dig more into it. Thank you and welcome, everyone. Welcome. My name is Toyin Taiwo. Um, and this live conversation is being hosted by the Feminine Health and Fiber Support Network. Um, I am a women's health advocate, and I'm a change maker. And this was birthed from my own personal journey of fibroids. And trust me, heavy bleeding. 2 years non-stop continuous bleed with no quality of life. So I absolutely understand when we say that heavy bleeding are not normal. I'm going to try and wait to see. Can someone help me prompt the doctor and see if she's joining? I sent her a message earlier on, but let's wait for the doctor and get this conversation on the way. I'm really excited tonight. It's been a while, but these conversations are really important to women must share their story, because it's important that we're speaking about these things, normalizing, talking about women health and wellness, so that the other woman can leverage, another woman can learn, another woman can know how to advocate for herself, and push back, especially when she's being gaslighted and her pain is being minimized, and normalized or dismissed. So yeah, this is why we're here tonight. We want to talk about heavy periods. Heavy period. What is heavy? What is heavy to some people might not be heavy to another. So let's find out from the clinician tonight and see what her guidance will be around all of this conversation that we'll be having today. I'm waiting for her to join me, but yeah, let's do this. Let's have this conversation. We need to keep sharing our stories as women, encouraging conversations like this so we can leverage on what each other's experiences, so that also we can be heard. We can also, because the more we speak about this and normalize it, number one, the younger generation the younger women also are learning and being educated and informed, and also things are being done. The right people are hearing these things. Policies are being impacted and being changed to help women, and yeah, this is why we must continue to speak about those things, and so that women can find support. Support is key. Support is key. That's, I can't even begin to emphasize how important finding the support network, finding a system to support you on your wellness journey. Yeah. So yes, yes. I'm waiting for the doctor. I'm excited. I joined early because I just wanted to see where um bear with me. I'm gonna try and see what's happening with the doctor. And also my other guest as well. She hasn't joined. Whilst I'm waiting for my guests, we're just gonna get started, just create engagement. And honestly, if you've joined tonight and if you have questions that you want to ask the doctor, or even my guest who's had the lived experience, please put it in the chat box. And let's have this conversation, because far too long, many women's pains been dismissed, have been dismissed, minimized, or normalized. A lot of gaslighting. So this is also about helping women to understand how to advocate for themselves. It's your body. You know how you're feeling. Don't let anyone minimize that pain. You know, Many women are struggling silently, with extreme heavy bleeding, with severe pain, fatigue, fibroids, endometriosis, PCOS, and many other menstrual health conditions, hormonal and menstrual health conditions. So, and sometimes women don't have the right support. They don't even know where to even look. They don't have answers. So yeah, this is what tonight's all about: changing the narrative, creating awareness, you know, education, and having honest and open conversations like this to help women on their wellness journey. Um, I'm gonna try to see if I can call the doctor. I'm not sure why she hasn't joined. Um, yes. Please like this video, subscribe to this channel, share with someone who you think should be listening to this conversation tonight, and please drop your questions. Drop your questions. Let's ask the professionals. Let's ask the people who might be able to help us tonight with all of these questions. Just going to come up quickly and call Dr. Omar and see why she's late. She's usually not late. Bear with me. Has she joined? Not yet. Give me a moment, please. Bear with.
Yeah. Okay.
Oh, you're here. Amazing.
Yeah.
Amazing.
No, I was, but I went in a wrong connection. Yeah.
Okay, that's fine. Welcome, welcome.
Welcome, welcome. You are mute, all Toya. You are mute. You mute yourself.
Oh, apologies. I was speaking through mute. I was saying, I'm waiting for my other guest. I don't know if that's her. Can you share your video? Is that Mofet? Please share your video if that's you. We can't see you. Welcome, Dr. Omar. How are you doing?
I'm good. I'm good. I'm fine.
How's your day? Are you enjoying the sunshine?
In the clinic.
How do you enjoy sunshine? You need to go outdoors, outside to get some sun.
Yeah. I can see it when I in the window, and also when I come back, it was okay. And now it is much breezier, nicer.
Yeah, but you should actually go in the sun. You get some
I
vitamin D.
do. I had the weekend, all weekend in the sun.
Oh, amazing,
Mm,
amazing,
mm,
amazing.
mm,
Well, welcome, Mofe. Thank
mm,
you all for joining this conversation tonight. I have with me. So today we're talking
mm.
about heavy periods. They are not normal. Um, I'll let
No,
my ladies introduce themselves. I have Dr. Omar. She's a consultant gynecologist, obstetrician, and I have Mofe Adisa. She's an endo warrior. You go first, Dr. Omar. Please introduce yourself, and then I'll let Mofe introduce herself too.
I am Kizal Oma. I'm a consultant gynecologist, and my passion is a complex gynecology, which is fibroid, endometriosis, as well as PCOS, which is now they call it PMOS. We no longer call it PCOS because it's changed the name according what is the
Yeah.
problem. Yeah, it is called polymetabolic endocrine syndrome because it is not a cyst in the ovary, it is a metabolic disorder. So
So what do we call it now? Is there a short
we
form for
call it PMOS.
PMOS? Oh, amazing.
Yeah, no anymore PCOS, it's
That's right.
PMOS because it is a polymetabolic endocrine syndrome. Because in the past, people
Mhm.
thought when they call it polycystic, they came to me, many of them,
Mhm.
saying, "Can you take these cysts out?" It's not a cyst; it is a endocrine problem, which is including ovary.
Ah, okay.
Yeah.
Okay, amazing.
Mhm.
Thank you, Dr. Omar. Mofa, do you want to introduce yourself and tell us a bit about you, who you are, how you got to be talking about your endo journey?
Okay, good evening. Hi, my
Evening.
name is Mofentola Adisa. I work as a brand manager, like social media management. So my journey with endometriosis. At first, I was I diagnosed 3 years ago. I just I started having this pain after my period, and it was very severe. So I went to see a gynecologist. The first person I went to see, I think I can't really remember the size. When I started having the pain, I did scan, so it now showed I that it's endometrioma, ovarian endometrioma. So that as at that time, it was linked to endometriosis, but I didn't want to believe that I have endometriosis. Like, where is it coming from? So I didn't have the knowledge I have now. I didn't have it as at then, because when they
Wow.
said
Mhm.
endometrioma, endometrioma is linked to endometriosis, I didn't believe it. So the first gynecologist I went to see, she recommended taking one particular injection, Zoladex.
Okay, let's before we get into details, Mofe, let's not get into details now. I know we'll get into the details. Let's kind of build it up so that you then share your story, around some of those symptoms and some of the interventions that you had,
Okay.
But before we get into all of the details, about the Mofes journey, why do we think that women are conditioned to believe that heavy bleeding is normal? Why? Because I mean, personally, I had an experience of I've always had. Well, Dr. Omar will tell us tonight if what is heavy for one person is not might not be heavy for the other person. But to be honest, I always thought that was normal because I was heavy bleeder, and I will wear 6, 5, sanitary pads, and I dare not go to bed without double layer, and all of that. And so that was my life. And then after a while, it really got really bad. And I just thought that was normal. I thought that it was okay, And but I didn't understand that there were underlying things that I had to look into and I had to address. But Dr. Ma, my first question is going to be to you. What actually qualifies as a heavy period? What should women look out for and not ignore and say, okay, this is heavy?
Yeah.
How do you qualify it?
Yeah, scientifically is very strange. They say, oh, if it is you are past within your each period 80 ml of blood,
How do you
it
measure
means you are
that?
anything more than 80 ml. Imagine 80 ml how much it is. If you look at 80 ml of blood, it means that you have a heavy period.
Mm-hmm.
So what they did, they weighed. They weighed all the sanitary towel before and then they weighed after and how much. But that is not the case. The case is how often you are changing the sanitary towel which is soaked, how
Okay.
much clothes you passing, how much sometime you telling me that many time you changing. Sometime you wake up in the night many time to change. This
Mm-hmm.
is not normal. That is not normal. Even if it is what the first day or 2 day or 3 day, that is not normal. And heaviness and also sometime is a length, not only the amount on a day length. Some people they have 7 to 10 day period, which
Wow.
is very,
So do we say
very
seven
too
to ten
much.
days is heavy?
It's quite heavy,
Okay.
and you carry on, and then sometimes it avoid you to go out the house. You have to stay in because you're afraid of changing.
Mm.
Sometimes people that they are in a supermarket or they are in a road, they have to go rush into supermarket to change their
Yeah, I
clothes
mean,
and
I,
buying underwear, buying a sanitary towel. So this is heavy, and
mm,
especially I have seen my visitor. I have my friends around, and poor girl sat on a sofa, and I was saying the food is ready. When everyone gone to the food, and she called me, she said, I think I stain your sofa. That is a
ooh.
heavy. That's a heavy.
And I get what you're saying, because
Yeah.
honestly, passing large clothes,
Yeah.
bleeding through your clothes,
Mm,
and I
that's not
I
normal.
I understand that perfectly, because there was a point in my life where even in my home, I
Mm,
could only sit in particular kind of chairs, because the
mm,
chairs that I
mm,
can wipe clean. I couldn't
mm,
sit on a proper sofa. I couldn't
mm.
sit in any area of the house that has carpet. It has to be the tiled area, so that it's easy to clean and all of that.
Yeah. Yeah.
So I do understand
Mm,
perfectly,
mm.
what you've just talked about. But I'm going to ask Mofa quickly. Do you want to share a little bit about your own personal journey with us, and what you've experienced with heavy bleeding?
So I wouldn't say I've experienced every bleeding at every time of my period.
Okay.
It's always, maybe I would say, like, maybe like twice or three times I can remember vividly that I had every bleeding. Like, say, maybe when I woke up in the morning, I around 7, I I used my sanitary towel. Like around 9, 10, I had to change. So I think it was just like 2 times or 3 times I've experienced every bleeding. So I do not experience every bleeding like that. I do not. It's not something I experience consecutively, like for every
Yeah,
period.
but
I
the times that you experienced it, I mean, was that quite heavy? I mean, hearing what Dr. Omar was talking about, how to measure it. So will you classify as heavy?
Yeah, I think I'll classify it as heavy because even the way it was gushing out, I could feel it that yes, this was heavy. I
Okay.
could feel it.
Oh, okay. All right. Thank you for that. Dr. Omar, hmm, when what are the common causes of heavy periods? I mean, it's what will let a woman have heavy periods?
Yeah, there are many reasons, which is including gynecological problem
Mm-hmm.
or can be blood disorder problem.
Mm,
So the gynecological problem mostly which cause very heavy period, fibroid.
mm.
Fibroid is one of the reason of the
Yeah.
heavy period.
Mm-hmm.
Um, Perimenopause people may have a normal period before, and suddenly after age of 45, they are just gushing out the blood and very frequent period. That's
Mm-hmm.
also imbalance of the hormone can cause the heavy period. And endometriosis. Endometriosis, yes, your guest said that she didn't count as a heavy period, but some people, yes, they don't have the heavy period. But if endometriosis is combined with adenomyosis, because this is a combination, sometimes women have endometriosis but not have adenomyosis. If there is adenomyosis, which is endometriosis in the wall of the womb, which you don't see it outside the womb, because endometriosis is outside the womb, if there is a combination, they will have a heavy period. And if it is a higher stage, also they have a heavy period. But blood disorder,
Yeah.
like either is happened like they call it von Willebrand disease or factors deficiency of the clotting, or
Mm-hmm.
can be secondary of the drugs which the people take. For example, if they have a clot in their body and
Mm-hmm.
they start taking the blood thinning tablet or injection or drip, then they will have a heavy period. But fibroid is most commonly associated with a heavy period.
Wow. Okay. Thank you. Thank you. I know that. So with endometriosis, as Mofet did say, she had endometriosis. How does that
Mm.
impact menstrual health?
Are you asking her or asking me?
Are you? I'm asking you. Sorry,
Yeah,
no, you, Dr.
yeah.
Omar.
No, it's fine. The impacting how it is impacting on the period is more
Yes.
or less, as I said, can be very heavy, but the pain they have it during ovulation, the pain they have it during intercourse, and the pain they have it during the period. Usually start before the period. The period time also painful. Sometimes it's slightly ease off after the period, but the pain which is associated again with a heavy period or a normal period, but as I said, normal period for someone is not always the normal for somebody else. So how you count it, it is different because it is how you brought up in the family. If they had a heavy period, so you think that's a normal thing. Could be in heavy, but your guest may be still thinking that wasn't heavy, but it is always heavier from somebody else. But also associate with pain. The pain of it is excruciating. It the people who are suffer from the heavy period, from the painful period of
Mm.
endometriosis or the fibroid, they say they had a baby. It wasn't that painful as they had the period pain due to endometriosis or fibroid.
Wow.
But
Okay.
but the
Thank you.
pain of endometriosis is always more even than fibroid.
Yeah. Hmm.
Mm, mm.
Okay. I wanted to ask Mofa quickly. So, in your journey, how did your condition of bleeding when you had the heavy bleeding or the endometriosis, how did that um how did that impact you emotionally? Especially,
So
did you feel like you were heard when you were speaking with a consultant or your healthcare provider? So how did that impact you emotionally?
the gynecologist I spoke to, he made me feel relaxed. It made me feel relaxed that okay, he didn't bring it up as something that it is actually a big deal, as at 3 years ago when all this started. It didn't make it seem like a big deal. So as at then, me too, I didn't see it as something that is actually a big deal. So it's affecting my emotional, it's affecting me emotionally. I won't say it's it just weighs on me overall because of the pain. Yeah, just majorly because of the pain, because you cannot it's not a fun thing to be living a life of pain.
Exactly.
And
Mm-hmm.
and I also experience ulcer, so I can't take any pain relief. So it is a lot. But however it is, I
Okay, but
take that this as it comes. When the pain comes, it's
mm,
sometimes it goes on its own, sometimes it lingers. I'll cry because I cannot take.
painkillers. So I'll let Dr. Omar address that. So, and this honestly, what you just shared is story for of some women honestly experiencing this silently, and also incredibly and isolated because they're not talking, or they don't have the right support, to be able to help them on this wellness journey. So, Dr. Omar, back to you. Why do you think women's pain? I mean, I'd like you to address at some point Mofe's issue where she's got bad pain, but she has another health condition that's not allowed us, that might not be able to make her take, the kind of painkillers that she
Seriously.
requires. But before you answer
Yeah.
that question,
Mm,
why do you think women's pain is often minimized, especially in
mm.
healthcare settings, and you're told, oh, I mean, because I'll share my own gaslighting after you go first, Dr. Omar.
Yeah, because people thought in the past that periods should be painful, but what pain? Because no one understand unless if you suffer from something, no one will
Mhm,
understand you properly how much pain you are on.
mhm,
And the area, especially with the endometriosis or with the fibroid, the area is so inflamed. It's
mhm,
so inflamed.
mhm,
It's like you have infection, you have inflammation, you have
mhm,
nerve stimulation. So
mhm,
no one understands how much pain you are on unless you like showing it to the people. You are missing school, you are missing work, you are missing even cooking for the family.
mhm.
They don't understand
Yeah.
unless someone is suffer from endometriosis or some from fibroid. I
Mhm.
believe even doctors, they will not believe some of the patient they are what type of pain they suffering from.
Yeah, yeah.
Yeah.
Because and to be honest, hmm. So I had a situation where I had a consultant who was dealing with me. I had fibroids. I've always known I had fibroids, and but I went on a wrong food path that cost me severe bleeding, non-stop bleeding, 2 years non-stop, and every time I turned up for my appointment, and he used to make me feel like I was making up stories. I was
Mm,
in a bad
mm,
place. I was in severe pain, and I
mm,
turned, I'm like, I really need help. Or is there any other? Because all he ever offered me from the start was hysterectomy, and I was avoiding that. And I was like, are there no
mm,
other options? Is there nothing else that that you can
mm.
offer me and all of that? So every time I turned up, it was as if, okay, what's it now? What is it now? I'm like, why are you minimizing my pain? This is a real thing. This is my life here. This is what, because all of this affects just not just emotional health, mental health as well. Honestly,
Mm,
in
mm,
what
mm,
we workplace struggle. I used to struggle at work. I used to work in the city. I had in my organization, it was a big building, sanitary pad hidden in toilets everywhere, just so
Mm.
I could survive. Those were just, of course, not to talk about relationship,
Yeah.
that also how it impacts that. So it's a
Mm.
thing that affects every area of a woman's life, really.
Mm.
So how
Mm.
can women advocate for themselves more, Dr. Omar, is what I wanted to ask you. And then
I
you please answer the help Mo first question around where while she's living with pain, she's not able to take painkillers for because of other
Yeah, unfortunately, as I heard
yeah.
from her that she have a duodenal gastric ulcer, and gastric ulcer they can't take any non-steroidal anti-inflammatory. But
Mm-hmm.
there are other medicine which should be provided for the patient when they are in that situation,
Mm-hmm.
which is called pregabalin, gabapentin, combination with the paracetamol, codeine, tramadol,
Okay,
cocodamol. But everything you take, unfortunately, has a side effect.
that's
There is
right.
nothing to say is even paracetamol. If you take it
Too much.
too many, too long, too much, it affect the liver. So it is not, nothing is without the problem. But when advised, if you have endometriosis or fibroid and you are in pain, don't wait the pain pick up into the top. Then you start taking the pain relief. You have to take the pain relief, even you have a niggling pain, because you know what's coming after, because you don't want the pain built up, because when the pain built up, no tablet can bring it down. So it's better to be taken regularly in time before the pain to be, because it will come anyway. But
Mhm.
as you said, nobody will understand you, nobody will. But nowadays, I'm very glad, is very much on the social media, is very much people know about it, very much people read about it, look at it, what is the condition. They read quite a lot, they see quite a lot of someone
Mm.
like us doing this like conversation on the YouTube or on the Instagram. So everything is on the place, and I see more people coming and
Mhm.
asking, do I have endometriosis or I don't? And
Mhm.
that is nearly 10 times or 20 times more than I have seen 2 years or 3 years ago. So
Okay.
everyone, especially the young people, they are afraid to be advanced before they get to the stage when they, even if they have diagnosis, the treatment will be difficult. So
Mm.
they seek advice more and more. But there are more other pain relief can be used in place of non-steroidal anti-inflammatory.
Okay.
Yeah.
Amazing. Thank you so much for that, Dr. Omar. Uh, um, and I just wanted to say also, ladies in the comment, please, if you've ever felt dismissed or that your pain was minimized, drop a heart in the chat box. This and that's why this conversation is around creating awareness and addressing cultural biases around periods and women health issues, honestly, and ensuring that women are encouraged to speak up and
Mm-hmm.
also to minimize and reduce delayed diagnosis, honestly, for women health issues. So,
Mm-hmm.
Dr. Omar, quickly, I'll come to you before I go back to Mofe and ask her a few questions. What treatment options exist for heavy periods? What are the possible solutions? What can women do?
First, the most important thing, the woman should be examined to be seen, to see if there is any abnormality. It's not just like what option we can give. We have to give option according what they have, and we have to diagnose it. The simplest thing now, ultrasound. Ultrasound is very much available outside the NHS hospital, outside the GP surgery. Some GP surgery even they provide the ultrasound,
Mm,
and gynecologists now all trained to do the ultrasound even in the clinic or
okay.
in the setting. So the ultrasound should be available. And I see, to be honest, within a month or 2 week or 3 week, according to the referral,
Mm,
they have their ultrasound. So ultrasound is very important
mm,
to include or exclude any reason.
mm,
Examination in the clinic is very important to see, because fibroid can be palpable, can be seen like it. And some people even they come to me, they say, "Oh, I feel a lump on my tummy when, especially
Yeah.
in the morning when I'm lying down and having a full bladder. So they sometimes diagnose themselves by themselves, so they know what they talking about. And then after that, the maximum thing you can do, especially for endometriosis, the best thing, which is MRI scan, can give us also the about of the staging, if it is a higher stage or lower stage. But lower stage is difficult, no MRI, no ultrasound. And then if still you can't just treat them blindly, you can give them pain relief. For also heavy period, you can give them a tablet which make the period less heavier, but again, take it in
Okay,
the
so
early
what's
time.
that tablet? That's what I was trying
It's
to educate.
tranexamic acid. It's
Okay, so
tranexamic acid.
that's what I was
But
alluding to. Mm-hmm.
you have to warn the women because tranexamic acid make a lighter but make a longer period. But you have to take it also very early before it become too much clotting. And the other option is a hormone, unfortunately. Some people they come and they say I don't like hormone, but hormone is the next option, or agonist hormone. I mean, sometimes we have to block certain hormone which affecting the endometriosis or affecting the fibroid to grow. So we have to block them, or you give them, which is a traditional one, like mini pill, which is progesterone only pill, or we give them combined pill, or the other drugs, which is blocking the pathway of the hormone, which is stimulating the fibroid or the endometriosis. But diagnosis should be made as early as possible because, for example, for endometriosis, laparoscopy is very important to diagnose and also in the same time of treatment and plan for the future.
Okay. All right. Thank you so much for that. Okay, I was going to ask Mofe, but are you still there, Mofe? I wanted to ask you around how this, if you had a lifestyle change that made any difference to you. But we're waiting for her to. Okay, I was asked.
Yeah,
Was there anything that you tried that helped, on your wellness journey? Is there any lifestyle change that you think would be useful to share if you did any? Or if not, that's fine.
definitely. So I had to cut sugar completely. I had to cut sugar completely. I had to cut intake of carbohydrates. I had to be taking more of vegetables, protein. So that has the pain is still there, but it's not as when I was taking a lot of when I was actively taking sugary stuff, and when I was taking, because I used to like fries, like fry plantain, fry yam. I used to, so I had to cut that, so I had to cut dairies like that. So yeah, they are like, these are the lifestyle changes I have made, and I think it has reduced the pain
Mm-hmm.
in a way, because the last one I had, it was crazy. For 2 weeks I was in pain, I was sick,
Mm.
when we didn't really know what, because it was combination of the endometriosis pain and ulcer. So the people, as I was getting treatment, they were like, okay, I should be taking yogurt. So as I was taking that, it was affecting it was a lot. So when I
Okay.
found out that, okay, this is it, so I had to cut everything, sugar, everything, dairy, everything, fries, like that.
All right. Thank you. Thank you. Dr. Ma, I wanted to come back to you. So, what lifestyle changes do you think might help support menstrual health? And the second question to that is, at what point do you think women should start to now then consider, I mean, if it's fibroid surgery, if it's fibroid or if it's endometriosis, at what point in heavy bleeding should women start to, find different options? How do you
Lifestyle is
consider?
very important because when you change the lifestyle, you change it for good health. To
Mm-hmm.
have a good health, to have like be fit, because the fat tissue in
Can
the
I say
body.
something quickly, Dr. Omar? Because when you change lifestyle, you need to know that you're changing to the right. You have to be informed
Right
enough to
direction.
have the right one. Because I
Yeah.
thought I was changing lifestyle, And then I started drinking a lot of soy milk with my coffee. Well, bad enough, I was drinking a lot of coffee.
Yes.
So, and that was for me, who had fibroid, was a
Estrogen.
no-no. But I didn't know that.
Estrogen.
So
They
it's
all
one thing
estrogen.
to think you want a lifestyle change, but also to be well
Mm.
educated about your
Mm.
condition, to know what food you
Yeah.
should stay away from, you know.
Yeah.
And it was in one of
Yeah.
these conversations that we had here that we
Yeah.
realized, well, you mentioned about yam, you know, and that's
Yeah.
something that
Mm.
we will eat as Black people. And there's another
Mm.
form of yam, the amala, that I love a lot, you know. So those are
Mm.
the things. If you're not well informed or educated, you think you'll have
No,
a lifestyle
you
change,
don't know.
but you're actually
Yeah.
making things worse. So that happened
Yeah.
to exactly why I thought
Yeah.
I highlight that. Yeah.
Yeah, lifestyle is, as you said, I have seen patients with polycystic people. They come
Mhm.
into me and they say, oh, we are in a Weight Watcher or something, or there are a lot of websites for the weight loss. And it was whole food which she was taking was carbohydrate, which the carbohydrate should be cut off up
Oh,
to the bottom. So
yeah.
yes, the lifestyle is very important. As you said, soya. Soya is have estrogen and increase the size of the fibroid, also stimulate
Yeah. I didn't know
the
that at that time.
endometriosis.
Mm-hmm.
Yeah, and yam the same. So you have to be careful what you're eating. And also the weight is very important because the fat tissue in the body produce estrogen, and estrogen stimulate all these tissues and increase the size of them. Um, Surgery. Surgeries depend on, as I said, uh, how big the fibroid, how heavy the period is with the fibroid or with the endometriosis. So where are they and how many of them? Where is the location and what type of them? It's not only surgery, and also don't forget fertility of the patient is very important because
Yeah.
if
Yeah.
they are young and they are still not having children and they planning to have their children.
Yeah.
I met a patient had a child and delivery. I can't remember because I don't want to say everything, and she knows that I'm talking about her. Then she had a ruptured ovarian cyst. She went to the hospital and they did a laparoscopy and they said, "Oh, this is endometriosis. Healthy baby, easy pregnancy." And then suddenly she found out that she has a endometriosis in her ovary. So
Oh.
yeah, so the fertility also very important. You have to look at is to see whether the patient wanting to have children or not. So the heaviness of the period or doing a surgery for heaviness of the period, because most of the surgery, unfortunately, is against the fertility.
Mm.
But of course, some of them, especially with the endometriosis in the stage 1 and 2, you can treat them, as well as 3 and 4. You can treat them and enhance the fertility. And but with the fibroid, you have to know where they are, how many of them, what is the size,
Yeah.
and do they interfere with the fertility or they don't interfere with the fertility. Then the surgery is indicated. The minimum surgery which we usually do, especially if the woman have no children, is the one which is sitting inside the womb, which
Mm.
become like a foreign body sitting inside the womb, like a contraception. So you have to take that out and then ask the women to if they want to be pregnant. If they become pregnant, how's the side effect of the fibroid on the pregnancy? How's the pregnancy on the fibroid? So these are has to be discussed and has to be explained. In addition, if you do any other surgery with taking big fibroid, multiple fibroid can cause scarring, and the scarring can also interfere with the fertility. But
Mm.
sometimes the position of the fibroid is so in a wrong place that
Mhm.
even IVF doesn't work because they can't reach the ovary because of the fibroid.
Right.
Yeah, and endometriosis by itself, the cyst in the ovary is interfere with the eggs
Mm.
because if they grow and grow and grow, then they will interfere with the egg production, and it's like you put in too much thing in the room, so you have no space anymore.
Mm.
So the eggs will be dying because of the endometriosis. So you have to treat it as soon as possible. But
Mm.
that is a minimum surgery to enhance fertility. But if the women have their children or they don't want to have children later in life, there are other options, not also only the surgery. And even before the surgery, we have this tablet which is antagonize the hormone pathway to stimulate. You can use it for 6 months, you can use it for a year,
Okay.
and revise again, and then try. So then you have other option for before the surgery. But for endometriosis, it's better to diagnose it early in days and
Yeah, but
start
that can
the
take long
planning
to
for
diagnose,
treatment.
isn't it? That can take long.
Diagnosis is very important. It's very important. You
Mm.
can't just give the hormone and say, take it, your pain will be better, and then in a few years' time become more advanced and more advanced.
All right, thank you. Thank you.
Yeah.
Mufes off again. Are you still there?
I'm here. I'm here.
Okay. I wanted to ask you around support network on your journey. What support system, do you have, or have you found? How important is support community to you, on this journey? Do you have any support network? Do you have any support system? And how important is that to you?
So I would say my immediate family and few friends
Okay.
that know about it, few friends who knows about it, who checks on me, who prays for me. So that's the small community I have, family and the few friends I have around.
All right. Thank you.
That
My emphasis is just around that, just to bring hope to women that there is hope and there is support and there's treatment, all around. You just need to make sure that you're speaking up and speaking to the right people and finding communities where women are leveraging on each other's experiences and educating and informing each other around things, and also fact checking with your healthcare provider. When you're in a community and the conversation gets started, it's just a starter, also conversation starter for you with your healthcare provider. But my point is, women do not have to suffer alone. You can find a community where you can be informed, educated, and also leverage from other people's experience, so you don't have to have the same outcome. But Dr. Omar, I wanted to come back to you,
Mhm.
and thank you, Mufe, for sharing your experiences on your endometrial journey, and how that's been for you. Is there any myth that about period that you think should end, Dr. Omar?
Sorry, anytime what I didn't
Any kind
understand.
of anything that's not true about period, a myth that about period.
I mean, the about the
uh,
period, it is
I
what
can't
is,
hear you.
sorry, do you hear me?
Now I can hear you.
Yeah,
Is there any
yeah.
wrong thing going around period that you think should end? That what's not true? Something that's not true around period.
What is not true around the period, as I said, the heaviness of the period and painful period, as well as there are other things which is around this, especially for your guest when she had endometriosis. Also the fatigue and tiredness and emotional impact, because you will be isolated when you are having too much problem around the period time. Then you will be isolated because you want not to be going out with the people, or you're not going to be communicating with the family. You want to be in your room. You want to just look after it, how much blood you are passing or not. So you have to be careful with that, because emotionally also impact. As you asked her about the support, also there is online a lot of endometriotic support society. You can talk to the people, you can chat and send them the messages, and they will send you back, and then they share their problem with you, they share their complaint with you. In addition, also, not only the period will be heavy and painful, sometimes they may have a bleeding also in between the cycle, or they may have a very frequent cycle. Sometimes I have seen patient coming, I am in 1 week of the month, I am okay. The rest, I have just a bleeding. That is really not life. You just feel how this woman is sitting in front of me
Mhm,
anymore, because
mhm.
this is, she say, it's for last 6 months or last 3 months, I am just having a week, and that week also I'm frightened every minute. I look at myself,
Yeah.
do I have a blood or not? So it's not only the heavy period or painful period, also the type of the cycle. It will change. It cause bleeding after intercourse. So you avoiding also relationship. All this is around the disease, which is causing you. Its impact from the top to the toe
Yeah.
is impact your life.
Yeah.
Impact your life. You are afraid
Every
to go
aspect of
out.
it.
Yeah, it's affect everything. In addition, having losing all these blood, it
And
affect your
even the
heart.
anxiety, you get
Affect your
anxious.
heart. Affect your heart. Anemic. You don't know. You are breathless. You can't walk. You can't climb. You can't work all day.
Oh,
Uh, And having blood transfusion, having iron transfusion, these are all affect your body.
it does. It does.
Yeah. Yeah.
At a point, I didn't realize that I was so anemic
Mm,
from bleeding was why I
mm,
used to be. I couldn't climb a flight of stairs, and I was like, "What
mm.
is wrong with me? Am I that
Breathless.
unfit?" And then I started going to
Yeah.
the gym. I'm like, maybe I need to go to the gym, to lose some weight and all of that. But I was so anemic, and then when I had
Mm,
blood tests done, and that's when I was
mm.
so, God, how are you still walking even?
Yeah.
Like, you need
Yeah.
to get in the nearest hospital now and get
Now, yes, now you
transfusions.
have
Like,
to go
really?
and have a blood transfusion. Yeah.
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 So I mean, that's a serious thing because
And
blood is
also it is
out.
serious. You may have allergy to the blood, you may have allergy to the iron, and iron infusion every now and then may cause staining of your skin, may have allergic reaction. So that's all impact on your body.
It does. It does. I mean,
Yeah.
at some point, because I was having blood transfusion so regularly. After a while, I was told that my red blood cells are not going to be producing enough anymore because
Mm,
used to
mm,
be help. Now, and I was in a situation where, okay, what do I do? I need blood because I'm losing so much blood.
yeah.
And then my red blood cell, I'm
Yeah.
not going to be producing. I'm not
Mm,
going to live like this for the rest of my life, but I'm grateful to God. I met you
mm,
and
mhm.
we started this journey,
Oh,
and it's really, um, it's been an interesting journey filled with
mm,
knowledge,
it's very. Mm,
information, possibilities, and now what I know now in retrospect. And that's one thing I wanted to say. What guidance, what advice do you want to leave with younger women before we close out tonight?
yeah.
What would you
Yeah.
want to say to the younger women, especially around period and heavy bleeding and heavy
Mm.
period? What would you want to say to
I
six
did
women?
say, please, please seek advice as soon as you can. Because when time
Mm,
goes by, your condition will be worse, and then the management of the condition will be difficult. But if you diagnose, if you find out what is going on, you have a plan in your hand, you can do whatever you need to be done, and you know what you're doing. Don't delay, because how much you delay, even if you are not in a relationship, because some people they say, oh, I am not in a relationship, I don't mind, I don't want children. That's not about children, that's not about relationship. You have to look after yourself. Even if they say, oh, there is nothing wrong, that's the best thing. Why not? If there is nothing wrong, then you know that you just have a little heavy period. You can sort out by other things, by tablet, by injection, by whatever it is possible. But seek advice, have a diagnosis. If it is there, you have to have a plan and ask, what is my option? Search, what is
yeah.
your option?
Mhm.
And then after that, you will find out a lot of option for you. But if you are last minute, then will be a last option you're going to be offered.
Yeah, yeah. If
Yeah.
you leave
I mean,
things, if you delay
I'm,
things.
I have the lady, and she's in her 30s, never had relationship, not have children,
Mm,
delayed, delayed, delayed. She had the last option to take the uterus out because
yeah,
there was no any other option.
yeah.
No any other option. And believe me, my heart was aching when I
Mhm.
was taking her uterus out, because
Such a
you
young
just
woman.
feel, I
Mm-hmm.
wish she came 10 years ago. We
Mm-hmm.
could have done different, and she could kept her uterus. Yes, she doesn't want any more doesn't have a relationship, doesn't have
Mm-hmm.
children. She have nephews and nieces. Yes, fine. That's not a problem. But that was not by her choice when
Yeah,
she had the uterus out, because she has to. If it is by choice, nobody will do that.
Yeah, yeah, and
Yeah.
that's why honestly it's
Mm,
important to speak
mm,
up
mm,
early and
mm,
then to start to
mm.
explore your options early so you don't leave it until it becomes really life threatening
Yeah.
or I
Yeah.
mean your outcome is only one because I mean one that's another thing that
Mm,
because I
mm,
kept ignoring all of those things and because I was
mm,
only offered
mm,
one option and this is why we advocate I absolutely advocate I say look
mm, mm.
if you speak up early, if you find help early, you'll probably have more options, and
Yeah.
you can better
Yeah.
outcome, you
Mm,
know,
mm.
another a better outcome than having to have hysterectomy,
Yeah.
So
Yes.
this is why we must speak about those things, normalize talking
As
about it.
early as possible.
And yeah, speak up
Mm,
early so that you can explore all the
mm.
options because there are
Yeah.
other options that you can explore.
Yeah.
And it doesn't
Yeah.
even have to be surgery. It doesn't have to
No.
start with surgery. It can
Mm,
start with lifestyle
mm,
change. You
mm,
can start with, alternative things that you can
mm,
take that can
mm,
help you,
mm.
the
Yeah.
fibroids. And so yeah, thank you so much, Dr.
Thank
Omar,
you.
for tonight. Thank you everyone who's joined us tonight, and thank you, Mofe, for sharing your story. And
And
it was really
I hope Mofi have her treatment. Anything is in the top pipeline. If she has her treatment done, if she has her management done,
Do you have a
i- if she
plan?
had
Treatment
anything
plan?
done.
So the last time I went to see a gynecologist. What he said was because of fertility, that because of the size, the fertility and the endometrioma, because they are both on the left and the right. So he suggested surgery for the removal
Mm.
because he also gave option of what's this for what's the word I've forgotten, like draining. Yeah, draining. He
Draining,
suggested the option of
clearing it
draining.
out, clearing it out.
There is probability that it could come up again, and he gave the option of taking contraceptive that would push the body into menopause. But because of I still want to give birth and all, so it is the option for the surgery that I will still have to go for, because the pain presently, self, I am experiencing the pain. So
I could
that's
tell
what.
because honestly, I almost said I wanted to say maybe you want to come off because I can tell you're in pain. I
Yeah.
recently sent a message to someone to check with you to
Yeah,
see
she is.
what's
She
wrong
is
with
just
you because we can tell
holding.
you're in pain. And
Mm,
this is why this is important and because it's a real thing. This is a okay, now we're having this conversation and she's actually genuinely in pain,
yeah.
and that's why we're having this conversation. We have to normalize having this conversation, finding
Mm,
options and finding
mm, mm,
treatment pathway for women.
mm, mm.
Mofe happens to be in the FHF community hub, so we're going to try and book a one-to-one consultation for a second
Yeah,
opinion with you,
yeah,
so that way she can start to identify all our options, and
yeah.
not have to stay with
Okay.
one. And then that way,
Yeah,
she
yeah,
can start to
yeah.
explore them. And also, Mofe, that
Mm,
I'm an advocate for. You have to start to. So this conversation starter
mm,
is good, but you need to be interested in your wellness and your health to start
mm,
to look for things so that by the time you're meeting with
mm,
um consultants or healthcare providers, you've done your own homework, your due diligence, and you're proffering like, oh, what do you think about this? I read about this, I
mm,
read about that. Guys, this is how we do it. You have to work together with the people
mm,
who are helping you
mm,
because they
mm,
don't know it all. But you
Okay.
must also be educated and informed enough to do some digging around your
mm,
condition to be able to work together with your healthcare provider to
mm,
find you the
mm,
best outcomes, to find you the
mm.
best plan for you because every woman is unique. And so find the best plan, for you. This is an amazing conversation and thank you. And I do hope
Thank
that
you.
you can go and get some relief this night. I don't know what you
Mhm.
will do for especially
Mm.
Dr. Ma, what can she do tonight because she can't take painkillers? What are you suggesting she can?
Just
I mean,
hot,
just a
hot.
guidance,
If
huh?
there is any hot bottle and paracetamol, she can take paracetamol and hot bottle. Is there any codeine around? Is she live here or live abroad?
She lives abroad.
No.
Mm.
Yeah.
Is there any codidromol, cocodamol?
No.
Or
No. I can get from a pharmacy. I can still get from a pharmacy this
All right,
night.
so get you some
Mhm.
pain relief, please. Get comfortable.
Mhm.
Get hot water
She's in
bottle.
pain.
You know,
She's in
yes,
pain.
and
She's
be
in pain.
comfortable. I
Yeah.
did think you were in pain, and I was going to
Yes,
say,
she's in
do you
pain.
want to
Yeah.
come off?
Mhm.
You know,
Because
all
she
right.
can't
So
sleep
you go
properly. Yeah.
along and go and get yourself some comfort. Okay.
Yeah.
Thank you
Yeah.
so much for joining this
Thank you.
conversation. Thank you very much.
I will write one tablet to you too if you send it to her later.
Okay.
Thank you.
Okay.
Okay.
Thank
All
If
right. That's
hopefully they
fine.
have it. Okay.
Yeah. All right. Let us
you.
continue this
Okay.
conversation. Thank you so much, everyone who's
Thank
joined
you.
it. Let's just remember your health matters, your
Mm.
voice matters, and you are not alone. You are not
No.
alone. Get a community, get a support system. You know, it's really important. And this is how we help each other. We speak up. We do the things we need to do for each other as women, supporting one another, sharing our stories, and getting the help that we need. Thank you so much, Dr. Omar.
Thank you. Thank you so much. Have a good evening. Bye
Thank you.
bye.
And good
Bye
night,
bye.
everyone. Thank you for joining. I hope this has been
Bye bye.
helpful, useful, and if you do need
Mhm.
support, please reach out to us. We try as much as possible. We cannot help everybody, but we try, as much as
Mhm.
possible. What we can do, we do, honestly. But this
Yeah.
is what this is all about. And so,
Yeah.
thank you, everyone. Thank you.
Thank
Remember, your
you.
health
Thank you.
matters. Your health matters.
Bye bye.
Your voice matters. Good night, everyone. God
Bye bye.
bless.
Good night. Good night.
Good night.